Here's the complete script in full, all in one piece. Have you ever sat up fast out of bed and felt that quick wave of dizziness, like the room tilts for a second before it settles? A lot of people brush that off as just getting older. But there's real science behind why that happens, and why the first few minutes after waking deserve a little more attention than most of us give them. Before we get into it, if you find this helpful, go ahead and hit that like button and subscribe to the channel if you haven't already. We post new videos like this every day, focused on practical health information for getting older well. Let's start with what's actually happening inside your body while you sleep. During the deepest part of the night, your nervous system shifts into a kind of recovery setting. Your heart rate slows down, your blood pressure drops to its lowest point of the whole day, and your blood vessels relax. It's the closest your cardiovascular system gets to a real break. But that calm doesn't last all night. In the hours before you wake up, your body starts gearing up for the day ahead. Your internal clock triggers a rise in cortisol, often called the stress hormone, though it does a lot more than just respond to stress. Research on circadian rhythms has shown that cortisol levels can climb sharply within the first half hour or so after waking, sometimes by 50% or more. At the same time, your adrenal glands release adrenaline. Together, these hormones nudge your heart rate up and tighten your blood vessels slightly, basically priming your system to handle being awake and active. For a younger person with flexible, healthy arteries, this transition barely registers. But as we get older, a few things change that make this moment more demanding on the body. Arteries naturally become stiffer with age, which means they don't absorb sudden changes in pressure as smoothly. On top of that, many people develop some buildup in their artery walls over the years, often without any symptoms or warning signs. And after several hours without drinking anything, your blood is naturally a bit thicker by morning, simply from mild overnight dehydration. So by the time your alarm goes off, your body is already managing a hormonal surge, stiffer blood vessels, and thicker blood all at once. Then comes the part most of us do without thinking twice. We throw off the covers and sit straight up, swinging our legs over the side of the bed in one quick motion. Here's why that matters. When you're lying down, blood is distributed pretty evenly throughout your body. The moment you sit or stand up quickly, gravity pulls blood downward into your legs and your brain temporarily gets less blood flow. Your body has a built-in reflex to correct this fast, called the baroreflex, which tells your heart to beat quicker and your vessels to tighten back up. In younger people, this correction happens in a couple of seconds. As we age, that reflex tends to slow down, so blood pressure can dip noticeably, sometimes by quite a bit, before your body catches up. That dip is what causes the lightheaded, foggy feeling so many people notice when they first stand up in the morning. It actually has a clinical name, orthostatic hypotension, defined as a meaningful drop in blood pressure within a few minutes of standing. Studies suggest it becomes increasingly common with age, affecting a significant share of older adults, many of whom have simply gotten used to it without realizing it's worth mentioning to their doctor. Now, here's an extra layer worth knowing about. Overnight, you also lose fluid just through breathing, more so if you tend to breathe through your mouth while sleeping. By morning, your blood plasma volume is a little lower, which makes your blood thicker and harder for your heart to pump efficiently. Add in the fact that certain clotting-related proteins in the blood tend to peak in concentration in the early morning hours, and you've got a window where the cardiovascular system is simply working under more strain than usual. This lines up with research showing that cardiac events tend to cluster more heavily in the morning hours compared to other times of day. None of this means mornings are something to fear. It means they're worth approaching a little differently, especially if you're over 60. So let's talk about a simple routine that can ease your body through this transition instead of rushing it. First, when your alarm goes off, resist the urge to jump up right away. Stay lying down for a few seconds and take some slow breaths, in through your nose and out slowly through your mouth, with the exhale a bit longer than the inhale. This kind of breathing helps activate your body's calming nervous system response, which can help soften that early hormonal surge before it peaks. Second, if you can, keep a glass of water on your nightstand and drink some before you even sit up. Replacing some of that overnight fluid loss while you're still lying flat gives your blood a little more volume to work with before you ask your heart to do the harder work of standing. Third, don't go from flat to standing in one motion. Roll onto your side first, then use your arms to push yourself up to a sitting position, letting your feet hang off the edge of the bed. While you're sitting there, rotate your ankles in slow circles for about a minute. This might sound minor, but your calf muscles act like a secondary pump that helps push blood back up toward your heart. That small movement can meaningfully reduce the blood pressure dip you'd otherwise feel when you stand. Give yourself another 30 seconds or so, just sitting before you rise. And when you do stand, do it slowly, using your legs rather than pulling up with your back. Finally, take a quiet moment to check in with how you feel. Is there any chest tightness, unusual shortness of breath, or a heartbeat that feels off in a way that's different from normal morning grogginess? Most days, the answer will be no, and that's the reassuring baseline. But building this brief check-in into your routine means that on the rare day something does feel different, you're paying attention instead of rushing past it. One more thing worth mentioning. If you take a beta blocker for blood pressure or heart rhythm, it's worth knowing that these medications can blunt your heart's ability to quickly compensate when you stand up, which may make that morning dizziness more pronounced. That's not a reason to stop taking your medication, but it is a good reason to be extra deliberate about easing into your morning and to mention any regular dizziness to your doctor. Altogether, this routine takes less than 2 minutes. No equipment, no cost, nothing complicated, just a little patience with your own body first thing in the morning. If this was helpful, do hit that like button and subscribe so you don't miss the next video. We share practical, easy to follow health information like this every day. Take care of yourself, and here's to starting your mornings a little gentler from now on.